bonds.
Yeah.
Now, what exactly is the main focus of the forum, the conferences, when you come and you meet and you talk? What is the main focus?
Well, they give talk, they give presentation about certain topic, very visual, and they are the expert in the field, and I try to always to make a mix together. Like this year, we have someone from Russia, someone from Japan, and then from the U.S.
And how do you see, what do you see in the Vietnamese neurologists, what their reaction is to hear from all these doctors from other countries?
Oh, the progressive one, the dynamic one, love it.
They love it.
Yeah.
They want to learn more.
Yes.
Also in the studio with us today, we have Dr. Robert Daroff. He was the former president of the American Neurological Association and also former president of the American Headache Society. Thank you, Dr. Daroff, for joining us today.
A pleasure.
Well, the first question I want to ask you is, what made you decide to team up with Dr. Truong for this info program in Vietnam?
Well, I've known Dr. Truong since he was a trainee in neurology in South Carolina in 1982. I was a visiting professor there, and we became friendly, and I followed his career over the years as he made a name for himself in American neurology and in world neurology. When he told me he had the idea of having these conferences in Vietnam, I thought it would be a wonderful idea to help in training Vietnamese neurologists with an international cast of specialists from around the world.
So bringing it on a global scale. And now this info conference that you two have developed, it's been taken on in other parts of the country. Can you kind of give us your idea of how you would compare Vietnam's info conferences and others in the region?
Well, I can't speak to others in the region. I've been to world congresses actually in Japan and elsewhere throughout the world. This conference brings together neurologists and other specialists from the United States, Europe, Asia, and all over the world. And we develop a close relationship with the physicians practicing here in Vietnam.
Now, is it often that you do begin these relationships, you meet these other neurologists here in Vietnam? What kind of how is the relationship taken back and extended after the conference?
With communications.
Just with communication.
We communicate with each other. They frequently ask me lots of questions through email, fortunately, and we provide the answer.
So you're a resource. You become a resource for neurologists
yes.
here. And how would you say about the program here, the conference in Vietnam? How has it developed the neurological studies in Vietnam?
The conference, we've had 3. It's developed by a discussion with Dr. Truong and myself and others as to the faculty from around the world who would best deliver the kind of information that Vietnamese neurologists would need.
Now, Dr. Truong, I'd like to ask you, as an expert in the field of movement disorders, can you kind of give us an idea of exactly what movement disorders are? I mean, viewers at home, I'm not sure if they're too well versed in it.
Well, I think the best way to define for the layman a movement disorder is something that doesn't move right.
Move that doesn't move right, okay.
Yeah.
Layman here, I understand, okay. So in terms of your research, I know that Parkinson's is a part of it, but is there any more specifics to the movement disorder? Any area of the body or
well, there
type of movement?
Two areas. One of them moves too fast, too much movement, or too little movement. In too little movement, you have Parkinson's disease. Too much movement, you can have a thing called chorea. People like dancing, moving on around, or tick when they don't have much.
A tick.
Yeah.
So that's
and the body gets twisted with dystonia. So there are many kinds of the movement that doesn't move well.
Now, in terms of Parkinson's, which is a more specific type of movement disorder, can you kind of give us a little, in layman's terms again, what exactly is Parkinson's disease? What causes it?
Well, Parkinson's disease is a degenerative disorder. That means that the disease, the brain gets wasted over time. The brain cell dies slowly. So it creates certain symptoms due to the lack of certain chemical, so-called dopamine. And because of that, patients have some of the symptoms like tremor, slowness, stiffness, and they're falling easily.
I see Dr. Jaraff doing
That's
motions
a
with your
typical
fingers.
tremor of the hands of Parkinson's disease.
It's this kind of rubbing of the fingers.
Right, it's called a pill rolling tremor. It's as if you have a pill in your fingers and you're moving it back and
And this
forth.
is completely involuntary.
Totally involuntary.
And what can you say about the technology that Vietnam currently has in terms of treating neurological